Back to work, back to play.
Hello, Dr. Noah Volz here, looking at evidence-based exercises to heal common complaints. And today we're looking at posterior tibial tendon dysfunction. And that's just a lot of words to say pain at the inside of the ankle, kind of inside of the heel. Oftentimes when we're assessing this, we'll find that the heel is actually deviated slightly to the outside. We'll often find that people have pain or tenderness or numbness at the inside of the ankle when they point their toe or when they kind of come up onto their toes with their heels up off the floor. So today we're going to look at some exercises that you can use to help to remedy this situation, to help heal the posterior tibial tendon dysfunction quickly. So we'll go into those exercises now. So the first exercise we're going to do is called the standing inner calf stretch. This is an exercise that you will hold for about 30 seconds. You want to do this at least a couple times a day. The posterior tibialis muscle goes kind of through the inner calf. So we're basically stretching out that muscle, stretching out the tendon attached to that muscle to help relieve this particular complaint. So first you'll start in kind of a wide-legged position. Your feet are about 3 feet apart. Then you're going to turn that back foot in about 45 degrees. The other foot can be pointing straight ahead, and then you're just going to bend that knee, and then you'll feel kind of a stretch through the inner ankle, through the inside of the foot. That's really what you're looking for, is that kind of sensation. And like I said, you'll hold this for 30 seconds, and you'll do that up to 3 times a day, 2 times a day. So that's the first exercise, and we'll start there. So our second exercise is an eccentric posterior tib exercise. Similar to other exercises where we've done, we're gonna stand up here on a small step, and we're gonna lower the heel down at a 4-second count. And then we'll use the other foot to bring that heel up. And most of our weight is gonna be on the outside of the foot, so on kind of the pinky side of the foot as we do this. And again, you'll wanna do about 10 reps of this 3 times a day. So I'll go ahead and show you how that's done. So you're gonna come up onto your step. I'm gonna do this right foot here. I'm using the left foot to balance, and then coming onto the outside of my right foot, onto that pinky toe side, lowering the heel down, 1, 2, 3, 4, shifting the weight into my left leg in order to bring the heel up. And then again, 1, 2, 3, 4. And then I'll just keep doing that about 3 times, really feeling that stretch in the calf. And that's the second exercise. The third exercise for posterior tibial tendon dysfunction is a single leg stance with the knee slightly bent. So you're going to want to hold this for about 1 minute on each leg, and you're basically just balancing with that knee slightly bent. So I'll go ahead and show you how to do that now. So you're just standing on one leg, lifting the opposite leg, and then bending that opposite knee. So again, you're kind of feeling the inside of the heel, the inside of the calf as you balance here, strengthening that tendon. You do that for 1 minute, and then you switch sides and do the other side. So that is the next exercise. Exercise 4 for posterior tibial tendon dysfunction is a resisted sole to sky stretch. And this again is working on that posterior tibial tendon and making it strong. So this one, you'll want to do about 10 reps, 3 sets of 10 reps. That's the best way to do that. And so basically you're sitting with your leg cross-legged, you're using a band over that foot, and then that foot scoops up towards the sky, so the sole of the foot is reaching up towards the sky, and you do that 10 times. I'll go ahead and show you how to do that now. So I'm using the red CLX band for this, so I'm just going to go ahead and loop this around my foot, and then I'm stepping on the other side of the band with the other foot to get the desired tension that I want here. And that's pulling my foot down towards the floor. I'm going to bring that right over the ball of my foot, and then I'm going to stretch the sole of the foot up towards the sky, and then that'll pull it down, and the foot up towards the sky. And I'll do 10 reps of these. I'll try and keep my leg out of it as much as possible and just use my foot and ankle to reach up towards the sky, and then let that resistance pull the foot back down. So that is the next exercise, and we've got one more. The fifth and last exercise for posterior tibial tendon dysfunction is the two-legged standing calf stretch. It's just a simple calf stretch that you're gonna wanna do. And like the last one, you can do 3 sets of this. You can do 10 reps, and you're basically just standing. You can stand close to a wall, and you're just tilting your entire body forward and stretching the whole back of the legs. So I'll go ahead and show you how to do that now. So you're just standing here, and then you're leaning yourself forward as far as you can. If you need, you can stretch your arm out to move the weight, and then you come back to center, and then you stretch forward as far as you can, back to center, and stretching forward as far as you can. So that is the basic gist. Those are the 5 exercises that we recommend for posterior tibial tendon dysfunction. And then, so start there and see how it goes. As you're doing these exercises for posterior tibial tendon dysfunction, you will feel a lot better. After about 7 days of doing these exercises, if you're not having significant improvement, then you're gonna need a more thorough assessment to figure out what's going on. Sometimes posterior tibial tendon dysfunction can look like another condition, or it can be happening at the same time as something else. So you'll want to consider that thorough assessment. If you're already a patient here, you can bring up those exercises. We're happy to go through them with you, make any modifications that are specific to you, either making them easier or more complicated, depending on what's needed or depending on what's really going on with you. Or if you're completely new to the clinic, you can set up one of our free 20-minute consults, and we can go through the exercises with you and kind of look at how those may help this inner heel, inner ankle pain that you may be experiencing. We'd be happy to help with that. And as always, exercises are really a proactive way to get better, to keep you out of the doctor's office, including ours. Really hope that this video helped you, gave you some tools that you can use today to get yourself better, and look forward to teaching you more in the future. Thanks for watching.
Subscribe Proactive Chiropractic.